Growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, Dr. Steve Rasner here with the Lionhearted Dental Podcast. Welcome everyone. I'm doing another one right after work because most of you like when I do that, because it's my greatest chance to go on some kind of rant, which I am going to do a little bit on this one. My voice is a little going. I'm going to rename this soon the United K Germany Ireland podcast, since there's a ridiculous amount, I mean that in a good way, of followers over there. UK, Germany, Ireland, thank you guys. And Canada, you came back to me. Thank you. I don't know, this is what I look at. I go on this thing I'm signed up for that tells me how you guys are following, and so thank you. Enough of that. I'm in a good mood for a multitude of reasons. Having a killer week. I'm having a killer week. It's Tuesday. I mean killer. Probably more than some of you do in a month. And it's Tuesday. And I'm not saying that to be obnoxious. I apologize if that's how it came out. I'm saying it because it reminds me of every principle I give you this week so far. It's really two cases. That's what this week's about so far. One is a mandibular overdenture implant bar retained case. So I'm going to be extracting the one remaining tooth, placing 4 implants, putting them in a provisional, waiting 4 months, taking impressions, in the end prosthetic result 2 months later will be a bar that's retaining a prosthesis designed for that bar. And some of you may very well, and with good reason, question, why don't I get into all on 4 or all on whatever? Why not? And I think a lot of things that you do in your practice you don't even know are dictated, which they should be, by your belief system, by your philosophy of care. And I'm a guy that when I have a patient that is in a terminal dentition, this is me, you don't have to follow me, I believe that that patient's better served if I create a prosthesis that's the easiest for them to maintain. What could be easier than daily popping off a very solid, non-moving lower and sandblasting your implant sites with a water pick, which is what we advocate, or teaching them how to floss it, etc. And I do some zest locators as well. But that's one case. The other case is a remake of a patient who had implants done, not terrible, that the aesthetics of the case are just not good. The bite isn't good. The dentist inadvertently altered this patient's occlusion from a class 1 to a class 2 deep overbite, and she hates it. And I got to tell you, that was a very soft sell. It was. And it's everything I tell you. The woman was there. Her husband showed up a half an hour later because he was working. I don't know if that case would have went down. A very expensive case to fix it. Let me clarify that. It would not have happened if the husband wasn't there. And she was the perfect candidate for you to get case acceptance. Very unguarded, very motivated to come to you, in this case me. You ever have a patient like that? Like, you can tell in their banter, in the early body language and what they say, that they're excited that they are one of your patients now. That's not everybody. That's what this was. And I still liked her so much, and she had just had this case within the last, my cats are all over the place. If you're looking at me tonight, you can see I'm prepared for my cats. I got spray bottles of water that I don't even have to spray them. I just hold them up, and they're freaked out about it. That's for those of you who are looking at me. Hey, sorry. So what I'm going to talk about on this podcast with you this week is I want to start out with something clinical that's very easy for you to hear and jot down and either write to me or ask me the phone number I'm going to give you, and I'll tell you what this is. I wish I could think of more of these things, but it's very hard for me to communicate clinical to you over a video that's less than 30 minutes. That's the truth. So, did you ever do a case? When I say a case, it could be a denture. It could be a crown and bridge case on the maxilla, but you have full control of the case. You're doing the uppers and the lowers. And the upper could be anything from a denture to fixed crown and bridge to on fixed implant crown and bridge. And when you get to a certain point late in the case, the patient has a very obvious cant on their horizontal plane. It may go up to their left or down to their left. And then, of course, the front teeth have a slight off-axis tilt as well. So, do you ever have a case like that? Or a case where you couldn't remember whether they started with an anterior open bite, but now you're at the finish and they do have one. So, what am I talking about? Number one, if you're watching me, and if you're not, it doesn't matter, get yourself a horizontal grid. It's a clear plastic grid that has vertical and horizontal lines on it. You might be able to download this on your computer, by the way. If you want to get a hard copy of it, I got it from Strupp, Bill Strupp, at 800-235-2515. And tell him I sent you so I get my 30 cents. I'm kidding. I think it's cost like $25, but as I said, you might be able to download it. And I can see from me holding it on the monitor that you really can't see this very well. Here's what it does. Anytime you start a new case, starting tomorrow, I'm talking about the consult visit, and they have accepted your treatment recommendations, get out your camera, sit them in the doctor's chair, and make sure their head is looking at you with their eyes open. Their head is completely in tune with the horizontal plane of the earth. Their head can't be cocked left or right or down or up. It's got to be perfectly straight, looking straight ahead towards you. And then you take a photograph of that, and make sure you take a photograph that gets forehead to chin. You got me? Number one, if you don't have a camera, even if you're an associate, that's your number one investment as soon as you can. It makes you an instantly better dentist. It does. I mean, just like a scanner, if you have a scanner in your office, also makes you a better dentist because you can see your preps a little more clearly, in my opinion. I mean, you can see them with a hard analog impression also, but staring at your impressions on a TV monitor can be humbling, correct? But you don't worry about that right now. We're talking about getting a flat, perfectly parallel picture of your patient looking at you with their eyes. And then you're going to get this horizontal plane, and you're going to draw a line through an area on their face that is perfectly level. Now, sometimes their eyes are not perfectly level, so you have to find a space that you trust. Okay, now you can also, again, do this on your computer because you can download their picture on your computer, and you have to download a horizontal and vertical grid, and you overlay their picture, and then drop a second line down to their mouth and find two spots in their mouth that correspond to the first line you drew higher up on their face that you believe is parallel and horizontally correct. You got me? What that does on day one is tells you what you started with in reference to, does the patient have a canted maxilla by nature? Some do. Or maybe the denture they came in with is canted. And this exercise will save you so much grief down the road, guys. So number one, get a camera. When I say number one, get a camera, a good camera, I believe, is somewhere in the vicinity of $3,000 to $4,000. You should have one. Number two, get this horizontal grid and begin recording. You don't have to do this if you're doing a 3-unit bridge or 1 implant, but if you are affecting the smile zone, then you need to do this. The second thing you need to do, And these are little things that are easy to slip by you, right? You're busy. It's the end of the day. You didn't expect this case acceptance, perhaps. And I don't know. The second thing you do is you take alginate impressions. You capture their vertical occlusion. Now, it could be your maximum MIC, or maximum intercuspal position. That's an acquired position that they've gotten used to. At least know where you're at on day one. That is not a centric recording. That's something else. And you don't always need a centric recording. Now, there's those of you out there that will just kill me for saying that. What you need to hear is there's different points of philosophy on what is needed. And all I'm asking you to do is know where your occlusion was on day one. We can worry about, if we're rebuilding the case, getting them into a centric relation position, and that's way beyond the level of this discussion tonight. This discussion is going to the masses of you, the 10,000 of you that are downloading me every week. I'm kidding, by the way. It's not that much, not even close. By the way, I like some of you. I'm trying to get more popular on Instagram. This is completely humbling to say this to you. I don't understand it, so I don't know how to get bigger. I have like 500 followers on Instagram. I'm pathetic. Somebody that does something obscene has more followers than I do. And so, or you could be my Facebook friends. I mean, you follow me. So follow me on Facebook or Instagram. I'm going to put energy there soon, so it'll be worth it. A lot of the stuff you see that we're talking about right now, in fact, ends up in those social media sites. So the clinical takeaway today was capture your patient's horizontal plane before you ever pull out a drill. Also capture anything you do in the aesthetic zone. I don't care if it's one crown. Be sure that you took a picture so you have a documentation of what you had before you started. And then also capture their present occlusion when they bite down. Okay, now I'm going to tell you, I think some of you take joy when I tell you these things because you can, I don't know, relate to your own situations. So I had an emergency morning meeting today. I wouldn't recommend this, but I'm telling you this because you know that I tell you the absolute truth when I get on this camera. And good or bad, you can learn from it, right? So here's what happened. The biggest problem I have right now, which may be not the case for many of you, is no matter how hard I've tried in the last year, there's some time in my day, there's too many patients. And you heard me on several podcasts say, take more time, you'll make less mistakes. It's absolutely true. And even if that wasn't true, you will be happier not being crazy and rushed from room to room and not connecting with your patients. So I've tried a lot of things. And I'm going to tell you in a few minutes things that I do that I haven't talked about with you and how I fixed them this year. I'm not going back 5 years ago, this year. So I'm always trying to improve my product. My product is me. It's my office. It's my brand, to be honest with you. And I don't like my brand lately because, and I told my staff, I said, and so I was in the car and I did not want one more day to go by without at least getting the message out there. And I told them so. So when I was in my car on the way to the office, I asked for key members of each team, the key member of the clinical assisting team, all the front desk people I had here. And I'm going to tell you what I said. And maybe I'll regret this. Like I'll look back at these podcasts and I'll say, well, what was I thinking when I told them that? But I don't know, something's telling me to share this with you. Okay. So I had everybody in there except I didn't have my hygiene team in there at that point because I didn't need them. So I go to my insurance department first. Now it's a long story because I don't take insurance, but we do submit the papers on behalf of the patient. And sometimes, in a lot of cases, we will deduct the $1,000 max from the fee that we expect them to get. We don't do that often, by the way, but that's why I have an insurance department. Because if you do it twice a week, it adds up to a lot of money. So imagine a case in my office is $5,000. It's usually more than that when we're going to do this. And they were stone cold sure that even going out of network to come to me, that they will use the max. In other words, they're going to get paid less and punished. Thank you, insurance companies. You're so ethical that you punish patients and pay you anyway for going out of your stinking network. Don't get me started. So it doesn't make a difference sometimes because the case is well exceeded. So that's why I have an insurance department. So I said to them, you're only in here for a minute for one reason, and then you can go. What I'm about to say is I need a collaborative effort from everyone in this office, or what I'm trying to achieve, meaning not being overwhelmed during my day because there's somehow 5 patients in this 1 hour and a half toward the end of the day. Or sometimes it happens at 9 o'clock in the morning. No matter what I do. And so this is what your role is. You're going to pick up the phones on the third ring at the worst. If somebody doesn't else do it, you do it. And you're not going to do it. So I'm talking. Just like this. Staff, you don't like it? Tough love goes a long way. I'm sorry, it does. Please do this for me. Listen, I really need you to do this because it's going to help. No! It's your job. And I've told you about it. I didn't say it like that. Many times. And I don't need it to last for this week, for the next 4 days. Or this week and next. It is your job. And the reason I need you, that's all I'm asking from you, the insurance department. Because what I'm about to ask them is going to take a much greater deal of time. And I'm not asking you to do that. Unless you pick up an emergency call, and we have an emergency slips, guys. I'm talking to my audience right now, you guys. So we have a very strict protocol, and you may want to ask me to send this to you. It's a beautiful system. It's a bright orange neon informational piece so that I can't miss it. If it's sitting at somewhere on my black granite desk, it bleeps up at me to pick me up because I'm important. That's why I made it neon orange. But it has to be filled out properly or it's a waste of time. A crown's off. Is it your crown? What year was it made? Is it a history of post and core? Has it been out before? You get me? You need to write to me and ask me about it. And this is why I made that protocol. It's called the Emergency Protocol Documentation. I made it because you need thorough information to make intelligent decisions about patients. And a lot goes into this. I could use up the rest of the podcast by telling you this. Okay, I can already tell you I'm in too far into time. Then I went to my staff and I said, okay, here's the thing. We're ruining our brand. And by the way, I warned them about this a year ago because we started to have this tremendous influx of patients beyond anything I'd ever experienced. And it's still there. I said, we need to handle this gracefully. It is not worth it to me to look frenetic, look chaotic, disorganized. And I need all of you to assist me with that goal. And right now I don't have it. So, and it takes abundant energy. This is what I'm telling my staff that's sitting in front of me this morning that didn't know this was coming. So when you're rescheduling patients, you have to know a lot more than you do know right now, okay? It's because that's how we do it. We have the clinical team, and that's why I had a clinical team staff leader there. And I told her, I need you to give yourself more time because you're ruining my vibe. You're ruining my karma. You are. Because I fixed my problem. I give myself a huge amount of time for my procedures. More than I think I need. Now, I'm not doing fillings, guys. And if I was doing fillings, I would give myself more time to do that. Just not as much as I am to do surgical procedures. And remember, my patients are sedated. Most of them are. So it works out very nicely for me. I know it sounds, I don't know how it's going to sound. I don't know what the word is. The patients don't know if you start them 20 minutes late, a half an hour late, whatever it is. They're forgiving because they're snoring. And by the way, it's a great deal for them because they get so much work done because we can keep them in a chair comfortably for 3 to 4 hours. So again, the sedation is a big part of my success, as it would be for you. So what I needed to explain to my team is that not only does my clinical team need to put the right extra time in for me, but they need to do it for themselves. Because I have a second schedule where my team is preparing things for like an insert of a crown, an insert of a bridge, a trying of a denture. And I have to make very quick and easy decisions because I'm not going to be in there moving denture teeth around. Why would anybody want to do that? So I go into the room when that assistant feels they're where they need to be, where I'm going to want it. Now, not every dental assistant can do this. I get this. So I want that schedule to have more time than it needs. And then on top of that, I asked my 3 clinical staff members to be vigilant and look at the schedule constantly. I mean it. That's what I said. I don't know if this is resonating to you because it was my problem, and I don't know if you have that problem. What the takeaway here is I don't let things simmer. I don't. I was not yelling or screaming. I was talking like I'm talking to you, and I was telling them the benefit of doing this. I would understand that anybody walking out of this meeting would be upset if their boss was saying, I need more patients. We need more money. It's not what I'm saying. It's the opposite. I'm saying we need more time so we can be less chaotic. Seriously. That was the whole goal of the meeting. Can you imagine a boss coming in trying to get his staff to take more time? I said, wouldn't that benefit all of you? It'd be less hectic. I mean, it's not hectic 75% of the time. It's perfect. But that's not 100% of the time. So why not go for 100% of the time? And it requires really a lot of diligence. Let me give you an example. So a guy came out yesterday that had been in a case for about 9 months. A lot of implant cases take that long. And we are at the very end of the line. And he did a wax tooth trying, just what I just alluded to a minute ago. But this was over implants and a bar. But the teeth were not finished. They were in wax. And when I evaluated it, when I went into the room, I noticed, by the way, a horizontal cant on him that was inappropriate. And his midline was off too. That's another thing the grid will help you with. And so we had to go back for a retry-in to correct those positions. And when I did that, I didn't want him to go to the front desk and have them say, okay, our next opening is December the 3rd, which it might be, by the way, for a big clinical visit. That's what I said. You guys have to be in touch with what I did. The front desk needs to be in touch with what the clinic's doing today and what this particular patient has gone through, where he's at in his treatment. Can you hear me? Can you feel that, guys? That takes a lot of research. And sometimes you'll need somebody else to pick up the phone because I'm expecting you to be a part of this well-oiled machine that requires a little bit from everybody. No, you're front desk people that take payments, that schedule appointments, that do a lot of ancillary important jobs, but I also need you at times to read a chart, review it, especially if it's a call-in to the office in the form of an emergency sheet. That was a rant that probably made no sense at all, right? Did I just waste 5 minutes of your time? I guess what I'm trying to do is make you understand how to be a peak athlete. In our case, as dentists, we're the athletes. Unlike a golfer, just about unlike anybody else, you have to surround yourself with peak athletes, which are your team members. And those team member athletes have to want to train, and your job is to get them to want to train, because the value in them becoming peak performers like their boss, the dentist, is you get to call shots. Like, you don't have to be open at nights or weekends. You can charge fees commensurate with that commitment to excellence. The payoff never stops. You can have a week like I'm having this week, where the week is a result of many weeks before. It's not really even the result of what's happening this week. It's not, because we're not that great this week. We're not, or I wouldn't have to have this meeting. Look, sometimes we do very well for weeks of months on staying on time. And we were off a little bit last week, and I went a little cray-cray. And I think constructive cray-cray is good. I'm not telling you to raise your voice and yell. Like, see, if I had prepared for a meeting because of my busy life right this second, it may not have happened till November, and I'm not waiting for November. I said, I don't expect you to give me all the solutions today. I am planting this in your head so we can get solutions going here rather quick. And I respect your input, team. I can't do this alone. I need your help. The help is, how can we have more consistent, even flowing schedules? Not great from 9 to 3 and then haymakers from 3:30 to 6 because somebody didn't think it out. Look, some things you got to put right in. I had a patient yesterday, had a Maryland bridge pop out, break. I don't do many Maryland bridges, folks. And it broke, and she's missing 7 and 10 because that's what the bridge covered. So my first question, which I am teaching my staff to do, you have to think like me. Do you have anything in your mouth? Do you have a backup that I make you a provisional removable? And I know what I did on that patient. And so she was okay with wearing that till she could get in. But maybe she didn't have that. So I might have to get her in to impress to make one, because I can't make a Maryland bridge, which I don't make many of, in a matter of a day or two. Anyway, I know we all have different issues. I'm hoping this address some of yours. I want to tell you a lot next week. I'm going to type it right now about how to get great documentation without you, the doctor, doing it all. You'll need to have some templates, which maybe you've already created. But it's got to be you, your style. I am much more strict about how we document. When I say document, I'm not just worried legally at all. I want to know exactly what I'm doing today and how it relates to what I'm doing on this patient on her next visit. Because a lot of my patients' cases are multiple visits of lots of different things that we're working on. And you know why that's the case, guys? Because I 100% do comprehensive exams. I do not do one-tooth myopic dentistry because you shouldn't do it. There are markets of dentists who are comfortable with that. I'm not. Anyway, I hope you have a great week. Let's tear it up this week. Have a great one. See you next week on the Lionhearted Dentist.